Hi, I'm Dr. Singhania from Singhania Clinic, and I'm here to talk to you about child therapy. Therapy is a form of treatment that tries to heal or improve an illness or an educational disorder or a psychological disorder. So it entails the whole concept of healing. Therapy in children differs from that of an adult, especially if you're talking about the psychological kind of therapy. Why does it differ? Because children don't have abstract thought the way we adults can analyze our problems or understand our problems. Children don't have that kind of cognitive thinking. They don't have complex language, particularly if they are very young or if they are distressed or if they have learning difficulties. They don't have insight into their own situation or their problems. And finally, children are brought in for therapy by adults, either by school or by parents. So what are the needs for child therapy? The most important, of course, is a therapist, because it's the therapist with whom the child forms a bond. So the therapist should be empathetic, understand child psychology, should not be up there, should be able to talk at the child's level. The atmosphere in the room should be warm, inviting, and most importantly, not intimidating. The child should not be afraid to come into the room. So the room should be calm, safe, and inviting. Calm and safe. It has to be the child's safe space. Now, usually therapy takes place in three parts. The first is to make the child feel comfortable and form a bond with the therapist. That may take a long time because it depends on how distressed the child is, and it may be done through just sitting and playing with the child or just sitting and coloring or painting. The second step is then to allow the child to tell his or her story in any way, either through play, through stories, through question answers, and finally the therapy can be started. Again, this depends upon the age of the child, the type of problem, and it could be through play, role-playing games, it could be very structured, it may not be structured. The other important parts of child therapy is the involvement of parents. Parents form an integral part of the child's life and they have to be part of the therapy. It not necessarily, they don't have to be there when the child is given therapy, but they need to be given therapy maybe or advice, or they must be told what is happening. Similarly, schools and teacher participation is crucial. It's important to understand that every child is an individual and disorders have different clinical presentations in every child. They impact the child differently. It depends upon the child's schooling, the parent, the family stress. So the diagnosis must include all this to create a special and a tailored treatment plan. Both weaknesses and strength must be noted. And these are examples of different kinds of therapies. For example, in ADHD, medication would be a form of treatment, though not necessarily a psychological therapy. But certainly social skills and coping skills training is important for children who may have been constantly punished or been rejected because they're too difficult or have learning problems. Behavior therapy and parent effectiveness training is important because often children may be difficult or maybe oppositional, or parents don't know how to deal, and they may actually enable the child, or they may be overly strict or constricting. Certainly the child needs remedial help if they have associated educational problems like dyslexia and other things like anxiety and depression. Autism is of course very specific, and treatment includes things like therapy or intensive interaction because it's a social and communication problem. Or applied behavior analysis, one of the most well established treatments for autism. Verbal behavior therapy, which is actually teaching children to use language or the pragmatics of language. Then of course language therapy, importance of visual strategies, picture exchange communication, the TEACH program. So these are a wide variety of different therapies given to children for different disorders. So if you're seeking help, please book an appointment at Singhania Clinic by calling 04-429-8498 or email us at reception@singhaniaclinic.a. We are located at Dubai Healthcare City. Thank you for watching.